Yeah.
So from CMMI, you then went to United, right?
Uh-huh.
What prompted that leap? That's a big shift from government to a big national payer.
Yeah. So, I think one of the beauties of these types of conversations is that we can be a little bit more honest and just authentic in our conversation. And yeah, so frankly, I was actually going through a divorce, and I didn't want to go through that divorce financially constrained. And so, working in the federal government, while it is an incredible gift to serve the country, I wanted to actually become a little bit more financially independent in order to go through a life decision. And so, working at UnitedHealth Group gave me that flexibility personally and financially, but it also gave me, and most importantly, gave me insight into what it's like to work for a publicly traded company and our healthcare delivery system. And so, United Health Group continues to rise the ranks of the Fortune, you know, six company now. At the time, I think we were closer to like 27 or 28, but still had sizable impact. And I loved it. It kept me in DC, it kept me part of the policy conversation, and really allowed me to serve as a translator between the business of making an impact from a United Healthcare perspective and an Optum perspective, because this was also a time when the UHG family in general was acquiring a lot of different assets. And so to translate that into the policy land, and vice versa, and to translate policy back to the business land. And it was a total blast to really see the inner workings and the complexity of what it's actually like to work at a publicly traded company. From United Health Group, I had an opportunity to go to naviHealth. And at that time, Tom Scully, former CMS administrator under Bush, called me and said, Kelsey, Welsh Carson, where I'm a partner, we just are starting this company called naviHealth, and I think you need to come join us. We're going to be a bundled payment company. And I was like, Tom, but I'm kind of like really loving this. I'm a vice president in my 20s at a publicly traded company. I'm kind of really satisfied and feeling really good about my choices. That conversation, of course, continued for a period of time, which eventually led to my departure from United Health Group and joining naviHealth. naviHealth was a total fulfilling blast and allowed me to have incredible proximity to actual Medicare beneficiaries, changing the workflow of frontline providers to really meet the needs of what bundled payments could actually offer them financially and from a clinical workflow design standpoint. So my job in a nutshell was to fly around the country to these large health systems and convince them that bundled payments was a safe place to start the game of risk and to take on risk, because you could limit it pretty aggressively. You could drop episodes if you didn't want to. Each quarter there was that option. And so it was an incredibly flexible program, in contrast to ACOs, which you would get attributed lives and you were kind of stuck with them. Once you found them, they were yours and you needed to manage. Whereas bundled payments, you could actually have a lot more customization based on the clinical episodes that our hospital partners would initiate, and then we would manage from a post-acute care perspective. And that was such a fun ride. We successfully stood up bundled payments across the country with very large health systems like Dignity, who I still talk to Rich Roth on the regular, and really started the foundational aspect of my foray into, really frankly, Medicare and senior care. And after naviHealth was successfully acquired by Cardinal, I was recruited out here to the Bay Area and joined Honor after they had just raised their Series A from Andreessen Horowitz, and had the opportunity to work with that founding team and really kind of learn the ropes of Silicon Valley and tech, and deciphering, tech versus human. And so this whole other perspective that I was able to learn, and of course that's why I loved it, is because of the amount of new ideas and perspectives that I had not been exposed to at that point in my career. Honor was doing really, really well, and was fortunate enough to have a really good relationship with Seth, who I still talk to this day. And starting companies in San Francisco is incredibly normalized. It's just what people do, and it's kind of bizarre. And by the way, it's not normal, but here it feels normal. And so that was really kind of the impetus of, I was working on a couple side projects, and that was really the start of Sitka in its early foundational days after I left Honor.